Hello everyone, welcome back to our channel. I'm Dr. Mel from City Skin Clinic, and today I want to have a little chat to you about Obagi-C System. This is one of the treatments that we're offering through our virtual skin clinic, and I thought this would be a nice way to follow up on my video about the Obagi Newderm system. I want to explain a little bit about the difference between the two systems, the similarities, and just give you an idea of, in terms of with our patients, when we might choose one system over another. And a little bit about what they're best for and what they're not so good for, and within the system itself, the difference between the RX and the FX system. So before I start, if you're enjoying our content, then please don't forget to like this video, give it a thumbs up, subscribe to our channel and ring the notification bell so that you're alerted with our new content. And also if you have any questions at all about the contents of this video or anything else that's kind of skincare aesthetics related, leave a comment below and I will answer. I'm also going to leave some links at the bottom of this video that I think would be useful. Firstly, about our Obagi skin clinic, our virtual skin clinic, also about the Obagi-C system, but as well about hyperpigmentation and acne, so that you can get a bit more detail if you like. So the Obagi-C system is one of their kits that's dispensed by your doctor, and the idea is that it should be a guided treatment. So the approach that we take in our clinic, and one of the reasons that we provide Obagi skin kits and treatments at home, is because it's a very personalized approach to prescription skincare. So through our virtual clinic, we sit and make a treatment plan that's based on your expectations and your goals, also around your lifestyle. And then we will sit together and make a plan about which treatment or treatments are best for you. And this can include, as well as prescription treatments, professional treatments, depending on your needs and desires, as well as over-the-counter things that you can go out and get yourself. If you're using products at home already that you like and that are doing you some good, maybe how to optimize them and how to fit them in with your new plan. It's not either or, and my kind of approach to skincare and beauty is that it really has to work with your lifestyle, and it can't be this one contained thing. It's a continuum of what you do yourself, what you get a little bit of help with, and what you might need to do professionally, and that's how you get the best results and how you can stick to programs and get the most out of them. So the Obagi-C system, it's like Obagi Newderm. It is designed to tackle skin aging, sun damage, and pigmentation. Those are the three main things that it's designed. Where it differs from Newderm is just the severity. So with the Obagi Newderm, like I mentioned, for hyperpigmentation or, for example, melasma and post-inflammatory hyperpigmentation, lines, wrinkles, sun damage, it really works well for moderate to severe cases, and it's a larger number of products, and it's just in terms of strength and in terms of the active ingredients and how much there is. Newderm has a bit more of that, and that's why it's aimed at moderate to severe cases. Obagi-C system is great for mild to moderate cases of pigmentation, so hyperpigmentation. It's great also for skin aging, and it's also really good for things like sun damage, melasma, and skin texture as well. But again, if you're on the mild to moderate case, and I'll be putting up some examples as I'm speaking now and as I continue, it's really good for that. Obagi-C system, like Newderm, has hydroquinone as its base if you're using the RX system, or arbutin as its base if you are using the FX system. The difference between those two, between arbutin and hydroquinone. I'll do another video about these, but it's just about pigment control. So in cases where there's hyperpigmentation, sun damage, melasma, arbutin and hydroquinone stabilize the melanocytes, and they prevent kind of uneven pigment distribution, and they just make your kind of lighten areas that are hyperpigmented so that your skin tone is even all round. So if you're kind of like some of the examples you're seeing, it's aimed at kind of evening the skin tone and getting rid of dark patches that can happen after acne flares, that can happen after sun damage, and also with skin aging as well. So that's the kind of the similarities between them. They also both contain exfoliating steps as well, especially the dry system in Obagi-C system. So that helps with skin texture and smoothing the skin. The other similarity they both have is they are at their best if you're able to combine them with a retinol or a tretinoin as a retinoid, and we speak to patients about this. That enhances the exfoliating and the pigment hyperpigmentation kind of treating aspects of them. So Obagi-C system, on top of that, where it differs from Newderm, is it actually contains vitamin C in pretty much all of the products. So the vitamin C is an antioxidant. It's great for helping kind of brighten the skin, for making, simulating collagen, for making the skin feel bouncier, a little bit more radiant. It's also, again, great for evening out skin tone as well. And it's great at protecting the skin. So that's a fantastic addition, in my opinion, for Obagi-C system. And so you really get a lot out of this system. The other thing is that Obagi-C is limited to 5 products. You can add on, so if you're adding retinol or tretinoin, obviously that increases a slight step, but it is less than the number of steps in the Newderm. And that makes sense because it's a system that's designed for mild to moderate cases. But it's also easier to use. So I might have a discussion with a patient who's kind of on the moderate kind of side, but they could go either way. If there's someone who wants fewer steps, then Obagi-C system might work better. So the nice thing with Obagi-C system, these steps, they're quite well contained. It's a nice little skincare routine. There are 2 kits, one that's aimed at normal to oily skin and the other normal to dry skin. And again, I speak with patients about their skin and their issues because it's not always so simple as just you have oily skin, we go with the oily kit. And I'll explain a little bit. So both kits contain a cleanser, and it's a really nice kind of refreshing gel cleanser. They both contain a morning serum, and they both contain a night cream and an SPF 50. And it's a fantastic SPF, and it stays really nicely with makeup. So the difference between the two is in the morning, if it's the normal to dry system, there's an exfoliant that comes with it, and it's an AHA exfoliant. And if it's the oily system, it comes with a toner. Now, I'll be honest with you, I generally prefer the dry system. Me personally, I have oily skin, sort of combination skin, but I prefer the dry system, and for a lot of the patients with oily skin, I also prefer the dry system for 2 reasons. Number one, the exfoliant is fantastic, and it's a really good way of kind of refreshing the skin and preparing kind of the new layers of the skin for these products. So in itself, I think it's a fantastic product. The tone is great, but I think the exfoliant, for me, I much prefer that. The other is that, especially if I'm combining this system with tretinoin, tretinoin tends to dry the skin a bit. So actually, it's nice to have an exfoliant to help work with that. So you'd use the tretinoin in the evenings, and you'd use the exfoliant in the morning. So again, I tend to look at the person's skin sensitivity. So if someone's got oily skin or very sensitive skin, I might be more tempted with the toner based. If someone, even with tretinoin or retinol, has very, very oily skin, then maybe the oily kit might work better. Or if someone doesn't do well with alpha hydroxy acids, then again. But usually for most people, I prefer the dry dry system, and that's again why it's important to have a process where your doctor's involved with you, and you have a kind of a deep discussion about your skincare needs and what your skin's usually like and how it changes. The system itself lasts for 12 weeks, and usually with these systems you start to see results properly after the first 6 weeks, because that's when the skin cells turn over. And then for most people, what we say is usually it's anything between 12 and 24 weeks. We don't use either Newderm or Obagi-C System for longer than 24 weeks. For some people, so for example, in my case, which I spoke about with the Newderm story, I started off in Newderm, and after 12 weeks, I was really happy with the direction it was going with my post-inflammatory hyperpigmentation, and I switched, but it wasn't exactly where I wanted it, and I knew that I would need to continue for a bit longer, so I switched over to the Obagi-C system. One, because my hyperpigmentation had then become kind of more of the mild in severity, having gone from really severe. And so I wanted to incorporate the Obagi-C system, and also I wanted to try it out. I was excited. And so that worked really nicely as to complete my treatment. For a lot of people, if you start on Newderm, they might want to continue the Newderm, especially if it's for wrinkles, but there's an option to kind of switch over to that system, to this system, if it's going in kind of you're really responding well to it early on. Again, with Obagi-C, the other thing with it is once you've finished the treatment course, whether it's 12 weeks, 18 weeks, 24 weeks, at the end of that, if we're really happy with the outcome, we then step you down to kind of a regular over-the-counter skincare routine, something basic to maintain these results. But you definitely should continue at least retinol after that, or you can continue on the tretinoin depending on how you got on with it. So there's sort of an after plan with these systems. In terms of what to expect, with Newderm, there's usually quite a lot of skin shedding, especially if we're using it with tretinoin. Obagi-C, there's a little bit less of that shedding, so it's a little bit of a nicer system if, again, your needs aren't severe and you don't want to have such a sort of an involved process. Like Obagi Newderm, you really have to be vigilant with protecting your skin and using SPF. It's no point in starting these treatments if you're then going to allow sun damage to reverse the results and make things worse. So you have to continue with SPF, and you really have to make that commitment that moving forwards you're going to use SPF. And again, it doesn't have to be continuing with the Obagi SPF. Any SPF will do. It's about just protecting your skin and building in these really good habits moving forwards. So this is a really exciting time for us in terms of delving deeper into skincare. We've always recommended skincare. We've always provided free customized skincare routines for our patients, and I see this as another kind of tool that we have that we can just really improve things. If you would like to find out a bit more about the Obagi-C system, please have a look at the links below to our treatment pages, and leave me a comment if you have any questions at all. Until I see you next time, don't forget to like this video and subscribe, and hit the notification bell, and see you soon.